Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Chronic alcohol abuse refers to the habitual and excessive consumption of alcohol over an extended period. While moderate alcohol consumption may not have significant long-term effects on the brain, chronic abuse can lead to severe and often irreversible damage to both the brain's structure and function. The brain is highly sensitive to the toxic effects of alcohol, and prolonged exposure can result in cognitive deficits, behavioral changes, and neurological disorders. Alcohol's pathway in the body. When alcohol is consumed, it is absorbed into the bloodstream through the stomach and small intestine. Once in the bloodstream, alcohol reaches the brain within minutes, where it interferes with the normal communication pathways between neurons. Alcohol acts as a depressant on the central nervous system, slowing down brain function by enhancing the effects of the neurotransmitter gamma-aminobutyric acid, GABA, which has an inhibitory effect. At the same time, alcohol inhibits the activity of excitatory neurotransmitters like glutamate. This disruption in neurotransmitter balance can lead to impaired judgment, slowed reflexes, and coordination problems. Effects of alcohol on the brain. Chronic alcohol abuse affects multiple areas of the brain, leading to both short-term and long-term neurological and cognitive impairments. These include neurochemical imbalances. Prolonged alcohol consumption alters the balance of neurotransmitters in the brain. As alcohol enhances GABA and suppresses glutamate activity, the brain adapts by reducing the production of GABA and increasing glutamate to maintain balance. This adaptation leads to increased tolerance, requiring the person to drink more to achieve the same effects. When alcohol consumption stops, the brain experiences a state of hyperactivity due to the increased levels of glutamate, which can lead to withdrawal symptoms, including anxiety, seizures, and tremors. Brain shrinkage. One of the most significant impacts of chronic alcohol abuse is brain atrophy, or shrinkage. Alcohol reduces the volume of both gray and white matter in the brain, leading to cognitive decline. The shrinkage is particularly pronounced in areas of the brain responsible for higher-order functions, such as the prefrontal cortex, which is involved in decision-making, planning, and impulse control, and the hippocampus, which is crucial for memory and learning. Studies have shown that even moderate drinking over time can lead to noticeable brain shrinkage, with chronic abuse accelerating the process. Memory and learning impairment. The hippocampus, which plays a key role in forming new memories, is particularly vulnerable to alcohol's toxic effects. Chronic alcohol abuse can lead to difficulty forming new memories, even if the individual retains the ability to recall older ones. This is known as anterograde amnesia. Alcohol also impairs the consolidation of short-term memories into long-term storage, which is why heavy drinking can result in blackouts or episodes of memory loss. Wernicke-Korsakoff syndrome, alcohol-induced dementia. One of the most severe and irreversible consequences of chronic alcohol abuse is Wernicke-Korsakoff syndrome, WKS, often referred to as wet brain. This neurological disorder results from a deficiency in thiamine, vitamin B1, which is essential for brain function. Chronic alcohol abuse impairs the absorption of thiamine, leading to a deficiency that can cause widespread damage to the brain, particularly the thalamus and hypothalamus. WKS has two stages: Wernicke's encephalopathy, the acute phase, characterized by confusion, loss of muscle coordination, ataxia, and abnormal eye movements, nystagmus. This phase is a medical emergency and can be reversible with immediate treatment. Korsakoff's psychosis, the chronic phase that often follows Wernicke's encephalopathy if left untreated. It results in severe memory loss, the inability to form new memories, confabulation, fabricating stories to fill in memory gaps, and personality changes. Unlike Wernicke's encephalopathy, Korsakoff's psychosis is usually permanent and can lead to long-term disability. Cognitive decline and dementia. Chronic alcohol abuse is a major risk factor for the development of alcohol-related dementia, ARD. This condition is marked by a decline in intellectual functioning and cognitive abilities, including memory, reasoning, and problem-solving skills. Alcohol-related dementia is caused by the cumulative damage alcohol inflicts on brain cells over time, leading to the loss of brain volume and neuron death. It is distinct from Wernicke-Korsakoff syndrome and can mimic other forms of dementia such as Alzheimer's disease. Mood and behavioral changes. Chronic alcohol abuse not only affects cognitive function, but also has a profound impact on mood and behavior. Over time, alcohol can cause significant changes in the brain's reward system, leading to dependency and addiction. This is due to the overproduction of dopamine during alcohol consumption, which creates feelings of pleasure and euphoria. As the brain becomes reliant on alcohol for dopamine release, natural rewards like socializing or hobbies become less pleasurable. This leads to increased alcohol consumption, tolerance, and eventually addiction. In addition, alcohol's effects on neurotransmitters like serotonin and norepinephrine, which regulate mood, can contribute to mental health disorders such as depression, anxiety, and aggression. Chronic alcohol abuse is often associated with increased irritability, mood swings, and emotional instability. Long-term health consequences. Chronic alcohol abuse not only causes direct damage to the brain, but also indirectly affects brain function through its impact on overall physical health. Some of the long-term health consequences include liver disease, alcoholic liver disease. The liver is responsible for metabolizing alcohol, and chronic abuse can lead to liver damage, including fatty liver, hepatitis, and cirrhosis. Liver dysfunction affects the brain through a condition known as hepatic encephalopathy, where toxins that are normally removed by the liver accumulate in the bloodstream and affect brain function, leading to confusion, disorientation, and coma in severe cases. Cardiovascular issues. Chronic alcohol abuse increases the risk of high blood pressure, heart disease, and stroke, all of which can contribute to brain damage. A stroke in particular can cause ischemic injury to the brain, leading to long-term cognitive deficits. Nutritional deficiencies. Alcohol interferes with the absorption of essential nutrients, including vitamins like B1, thiamine, B6, B12, and folic acid, all of which are critical for brain health. Deficiencies in these vitamins can lead to nerve damage, cognitive decline, and neurodegenerative diseases. Treatment and recovery. The damage caused by chronic alcohol abuse can be significant, but some effects can be reversed or managed with appropriate treatment. The first step in treating alcohol-related brain damage is to stop drinking alcohol completely. Early intervention and abstinence can help prevent further damage and, in some cases, lead to partial recovery of brain function. Treatment options include detoxification. Medically supervised detox is necessary to safely manage alcohol withdrawal symptoms, which can include seizures, hallucinations, and delirium tremens (DTs). Benzodiazepines are often used to control withdrawal symptoms. Nutritional therapy. Since alcohol abuse leads to nutrient deficiencies, particularly in thiamine, supplementation with vitamins and minerals is essential. High doses of thiamine may be given intravenously to prevent or treat Wernicke's encephalopathy. Cognitive rehabilitation. Cognitive rehabilitation programs can help individuals recover lost cognitive function, improve memory, and develop coping strategies to deal with the deficits caused by alcohol abuse. Behavioral therapy. Cognitive behavioral therapy, CBT, and counseling are critical in addressing the psychological aspects of alcohol addiction, helping individuals develop healthier coping mechanisms and avoid relapse. Support groups. Programs like Alcoholics Anonymous, AA, provide ongoing support and a community for individuals recovering from alcohol addiction, helping to maintain sobriety and prevent relapse. Conclusion. Chronic alcohol abuse is a serious condition that has far-reaching effects on the brain, leading to structural damage, cognitive impairments, and behavioral changes. From brain shrinkage and memory loss to the development of severe conditions like Wernicke-Korsakoff syndrome, the impact of prolonged alcohol abuse can be devastating. Early intervention, sustained abstinence, and proper medical care can help mitigate some of the damage and improve quality of life for individuals affected by alcohol-related brain injuries. Understanding the risks and taking steps to address alcohol abuse is essential for protecting brain health and overall well-being.